if you've got a disconnect, right? If you've got a subluxation, meaning a misalignment or stress on the nervous system, and that brain is not able to interpret information in the perceived or right way, that is going to ultimately disrupt communication between the brain and the body. I mean, there's no arguing this. Okay, like people widely accepted, pediatricians, neurologists, all the people that I've talked to in my community all agree that the nervous system is foundationally the root of all dysfunction and dis-ease, right? So a lot of times when we're now looking at, people with mental health disorders, whether it be, depression or anxiety or, PTSD or what have you, you can have a similar conversation or an argument to say, you know what, we still need to do psychotherapy. We still need to do counseling. And honestly, there are some instances where medication is needed. Okay. But at
Mm-hmm.
the same time, we
Glad you shared
also
that.
are now
Yeah.
starting to address, hey, what is the role of subluxation or
Yeah.
disconnection between the body and the brain? If there's a disconnect, and most of the time there is, how do we now help that? And it's
Sure.
interesting because my brother, he's at Ohio State and he studies cognitive science and neurodegenerative diseases. He's getting his PhD and
Mm.
he's brilliant. I mean, he studies brains for a living. And his particular area of focus is kind of the degenerative side, but he's also kind of made allusions or references to maybe studying kind of the more regenerative side, right? Where it's like, okay, what does an adjustment do to brainwave activity? So I think down the pike, as we kind of start, him and I, hopefully he moves back to Virginia, we can do some studies where, maybe we perform an adjustment and look at brainwave activity and how does that actually change? Because we've
Between
studied it in
those. Yeah.
degenerative
Yeah.
processes, but I would really love to see, if we could get, a couple case studies and see, hey, this particular case, this person was, had anxiety and this person had depression. Let's look at a pre brainwave study and then a post adjustment brainwave study and
Yeah.
what
Yeah.
areas of that brain are lighting up now.
Yeah.
So that's kind of where I foresee this going, or at least my career path going,
Sure.
um, into more kind of foundational research for our profession. And
Yeah.
that will substantiate a lot of what we're doing. In addition to the scans that we already do, in addition to, all of the testimonials that we have, now actually having actualized data and brainwave studies to look at
Yeah.
this. Holy smokes.
Yeah. So good. So good. And yeah, and I'm actually looking forward to that. I really hope you do kind of go on that endeavor because, we need to get more research articles into the medical journals, right?
Agree.
About
Agree.
chiropractic care, not necessarily the chiropractic journals.
Sure.
For example, Dr. Justin, who you met actually,
Mhm.
he recently submitted an article to, I forget the name of the journal, but it is a medical journal. So
Sure.
obviously jumping through hoops and trying to get it, all that, but it's
Yeah.
there, but we need more of that. So I love that your goal is to do
Well,
this.
yeah. I mean, the
All
medical
power to
community is becoming, believe it or not, they're more and more accepting of what we do, which is awesome.
slowly, but yeah, I am seeing that. Yeah.
There.
Yeah.
The tide is
Yeah, it definitely is. Okay, so in one bold statement, Dr. Josh, what does the future of healthcare need to become?
future of healthcare needs to become less about symptoms and more about root causes.
Dude, right there. See, that's why we need voices like yours in this space, man. That's
Oh
awesome.
man. Yeah.
Simple, powerful. Love it, man. Yes, root cause.